We're in season 4, and I'm so excited that you're here. So, if you're watching this episode, you know we were in the studio, and today we're virtual because that's just what life is right now. And we cannot forget our sponsor, That Good Peace, the luxury relaxation brand promoting peace and intentional mood. So, today's candle is Demand and Justice Manifesting Peace. I thought that would be really fitting for today's episode because we're going to be talking a little bit about healing, and we just need to always set the mood and make a peaceful environment for ourselves. So, if you joined us last season for season 3, you know that I lost my baby brother Ian due to a drug overdose. He began to self medicate with his depression and his anxiety. And once he got addicted to his pills, which we're learning all this in hindsight, to Xanax, he called his doctor for more. She didn't give him any. And per his text messages, he began to send out feelers to find some on the street. And he was given a bad pill that had fentanyl in it, and he passed away. He was 25 years old. That episode, we also met Marcus and Vernon. Marcus and Vernon were both addicted to heroin. But they also informed us that it's basically all fentanyl in the street right now. And a little update about them, Vernon has not been seen for a couple of months, so he's in our prayers from our Whole Letters TV family. And Marcus is actually in a 6-month inpatient program, and we're just praying that goes really, really well for him. I realize I'm at a point in my healing where I'm able to have this conversation more and more without crying, and I want to begin my outreach. And in the spirit of that, I met this wonderful guy we're about to speak to now. His name is Andrew Reinel. He is the outreach director at Behavioral Health Leadership Institute, a nonprofit that helps people with opioid use disorder. The Institute partners in communities in Baltimore City that are hard hit by the opioid epidemic to provide low barrier, high quality access to medically assisted treatment. He is a registered peer supervisor through the Maryland Addiction and Behavioral Health Professionals Certification Board, and he holds a master's degree in public policy from UMBC. So we want to welcome him onto the show and just get his perspective and his expertise on this opioid crisis because it's hitting us hard here in Baltimore. So you want to welcome you, Andrew. Thank you so much for coming on to speak to us.
Of course.
And I think first, I just want you to tell us a little bit about yourself and your why and how you got involved with this work.
Sure. Well, thank you for the lovely introduction. So my involvement with this kind of work was kind of serendipitous. It wasn't planned quite intentionally. My professional background is in a mixture of education and community organizing. As you had mentioned, I went to UMBC for public policy, and most of my organizing and education prior to grad school had been in the realm of fighting for immigrant justice. And it was sort of through, how sometimes opportunities come up through connections and acquaintances, and BHLI had been in the middle of expanding and looking for an outreach director. And despite me not having much academic or personal or professional experience in the field of behavioral health and substance use, they were looking for somebody to lead an outreach team that has skills that sort of lined up with mine. And so that's kind of how I ended up in this work. And I've been in it for about 3 years now, going on 4. And, frankly, I always sort of shy away from labeling myself as an expert, because on the one hand, there are so many people out there who know so much more than I do from both a personal and professional standpoint. But I guess I always try to do my best to learn from people, especially the people that are most afflicted by the opioid epidemic, and try to bring the skills that I do have that predate this work, um, to help people as best as I can.
So, on a daily basis, when you're at the institute, I know you had a lot of conversations with the patients that are coming in for treatment with the disorders. And what do you see the most? Like, was it a gateway that got them um, addicted to opioids, or like what are some of the stories you hear?
Yeah, that's a really good question. Um, I think what strikes me, and when you think about it, it's surprising and yet it's not too surprising, is that everybody has a story of pain, whether that's physical pain or mental, emotional pain, or both, because they're interrelated. When I get to know some of our participants a little better and they start opening up, um, there is often something behind, um, the substance use, or specifically the use, the seeking out of, different kinds of opiates. Um, to me, at least, the origin story always seems to be some kind of pain that people are trying to deal with.
That makes sense to me because I know a lot of people that get addicted to the pills. They might have had a surgery, they might have had something, and then they become addicted to it. And then mentally, like my brother, he got Xanax from a psychiatrist and became addicted to that. And then when he started to self medicate, once he became addicted, I said he was reaching out the street, and of course now he's taking something totally different that he's addicted to. So
Right.
how, like, what are some signs that we can look for that maybe our friends or loved ones are self medicating?
Yeah, I think it's hard, and I think, um, in one of your previous episodes about your brother, a lot of your family members really hit the nail on the head. As far as, it's always easy when hindsight is 2020, right? When you're in it, some of these behaviors you can chalk up to any sort of thing that sometimes is normal when people are stressed or scared, right? Um, but at least for me, and what I observe with some of our participants is, um, you never know what could be the reason, but when something just feels off, I think it's always worthwhile checking in with people and exploring that and just naming it for what it is. Hey, I've noticed things have been a little different lately. Is everything okay? And that's not a silver bullet. People may still feel the need to hide their behavior or how they're really doing. Uh, but you never know. There's other times there could be that one moment where there is a breakthrough and somebody's willing to share something.
Right. I know for me, my brother passed away on a Tuesday, and that Friday, he called me and asked me to get him a lift. And he said that he went to the dentist with his friend downtown and he was stuck. So I think for me, I don't know why it was weird because I called my other brother, like, does he seem off to you? But at this point, I mean, you could see it was a little too late for me. So I totally 100% agree with, if you feel like something's off, please ask questions. Like, don't be scared, like, because it can be literally like life or death. So I really, really, I think you should name it and just take it for exactly what it is, just like you said. Now, you specialize, well, your institute specializes in medically assisted treatment. So
Right.
can you tell us a little bit more about that?
Yeah. So, um, it's become a little more common nowadays, in at least in the medical field, although not entirely where we want it to be. But essentially, in terms of the opioid epidemic, medically assisted treatment, as its name suggests, um, is about the use of medication to help people in their recovery from opioid addiction. And so people often think of, methadone. Others might be familiar with Suboxone, which is the brand name for medication that's basically a mixture between buprenorphine and naloxone. Um, and there's others as well. But the reason this is important in this larger conversation about the opioid epidemic is because there's still a lot of stigma. First of all, obviously around addiction itself, but also there's a stigma, including unfortunately from people who have recovered or are in recovery, around the use of medication because it can be perceived as sort of replacing one addiction for another or using a crutch. And that sort of thinking can actually be fatal, right? Um, we don't say the same thing to people that um, take insulin, right? Or if you need prescription glasses to see better, um, why would you turn that down on some principle of no, I'm strong enough, right? There's so many examples of our lives of us using external help and tools to help us go about our day, and in this case, to survive, really, because opiates are so dangerous, right? Um, Medically assisted treatment really is seen as a very effective way to reduce overdoses overall.
I'm glad that you said that about insulin because I think that some people have it, but it is still that stigma that people don't understand that addiction is illness. Some
Right.
people still think it's a choice that you're making, and once you're in addiction, the drugs are making the decisions for you,
Right.
essentially. And I know on one of the episodes, I think it was Vernon, or it could have been Marcus, which is also my brother. That's also my little brother. Um, that it comes to a point where they're no longer taking the drugs to get high. It's to not go through withdrawal. It's to not feel the pain that
Right.
is associated. And what people, a lot of people don't know is that you can't just cold turkey stop taking a drug because
Yeah.
it can really have a negative effect on your body. It can really hurt you. And they need the medicine to wean. It's like weaning themselves off. So how does it work? Like, does it when you're medically assisted? Does it come a time where you can be free? Is it like little by little? Like, do they like progressively lower the dose where you're not taking it anymore, or how does that work?
Yeah, it seems to me like it's very sort of circumstantial. It depends on the person, right? And it's always a conversation that you should have with um, the medical professional that's prescribing with you. The unfortunate thing is that oftentimes, sooner or later, people that are on medically assisted treatment sort of get this idea that they'd be better off if they're working on their recovery without it. And for that reason alone, not necessarily anything about potential side effects or actual ways in which it's not working, but just to be able to perhaps feel quote unquote stronger, or to appease maybe people in their circle that are saying that they're still addicted, they will um, choose to try to reduce it or eventually go off it. And honestly, it's you know for some people they may need it forever. And I think one of the big messages is it's totally okay. Much like there's many other medications that you might take for the rest of your life, and um, if they're helping you, then there should be no problem with that.
That's really, really good to know. So I think a big question that I have is even in a lot of the celebrity deaths we've been seeing in the last year or so, it's like fentanyl. It just came. became this huge thing. Like I'm saying, the last couple of years, I never even heard of it. Then it just was in music and in TV and in videos, and so I imagine that now for the people that are selling these drugs, it's a big popular thing. And do you think
Yeah.
that that has increased the opioid epidemic or the effects of fentanyl? Like, what do you think about that?
Yeah, absolutely. I mean, my understanding is that, I mean, at least in Baltimore, and I'd wager in a lot of places on the East Coast and maybe the whole country, like it's hard to find. I think your brother said it, or both your brothers maybe said it themselves. There's no heroin out there, no pure heroin, pure cocaine. Even and the troublesome thing is that there's even other drugs um, that are laced with fentanyl, and so it's it's really a precarious situation that people are in when um, when they're buying drugs off the street.
It's it's definitely a gamble, and I wish that it's one thing to be addicted, but a lot of my audience is younger, and they might be easily influenced by the music that they hear, and I just really want it's one thing for me to say it, but it's one thing for you to say it. I'm like big sister. It takes one pill. It's like one. You could try
Right,
drugs for the very first time,
right, right.
and your family's burying you. So
Yeah, yeah. I think the conversation is important um, to have with young people, with everybody. Really, I mean, I understand artistic expression and um, you know, oftentimes artists are simply expressing the things that they experience. Um, and yet it's funny because you mentioned that, and several years ago, before I was in this field, I would hear a song like that and not think much of it. And now, when I hear lyrics with like Percocets in it, my ears perk up, and I'm like, oh, you know. And so, I'm not sitting here saying I don't want to get into the business of policing people's art. Absolutely not.
right,
The I think the lesson here is that these conversations are important, especially with our young people, so that they really understand what's going on and what these kind of things do to you.
I think that's so hilarious that you said that because, of course, growing up in the '90s, whatever, we'll hear them rap about weed. Whatever. I didn't care, but I
Yeah,
think now it's a trigger for me. I'm like, really? They have to say Percocet? You had to say fentanyl? Why? Like, what is that bringing?
yeah. Well, because I mean, I no, and I understand, and obviously it's painful, especially
Mhm.
for for um, for people like yourself, and yet it's almost an indication of how our society has changed, right? Like this is what people are expressing in their music because it's so prevalent,
That's true.
right? And that's what makes it dangerous is that like this stuff is everywhere.
Like it's what's hot right now.
Yeah,
And we're also desensitized about a lot of things
right.
that are going on right now. So I get
Right,
you're right. You're
right.
absolutely right.
Hey y'all, this episode is brought to you by That Good Peace, the luxury relaxation brand promoting peace, mental healthiness, and presence. Be sure to head over to thatgoodpeace.com to check out all of our handmade candles, teas, and essential oils to levitate your senses, teleport your mind, and manifest your mood. This week's featured candle is Demanding Justice, Manifesting Peace. To experience this candle for yourself, use the code LFMM4 at checkout for 20% off all of your products.
Yeah.
So another question that I had is like I grew up and my father was an addict, but of course I didn't know that as a kid. I just was like, where is he? Or he said he was coming, and
Mm.
I think as an adult now I know that it was his illness moving and making his decisions for him. So what kind of advice can you give to children right now who are dealing with parents that are suffering from substance disorder?
Yeah, that's a tough one, man. But you know, I would probably say, and it's it's not irrelevant, because sometimes people do come to us with their children, and for whatever reason, maybe they couldn't find childcare, the child is off from school, what have you, right? But I would probably say, I would want to reiterate that it's an illness, right? And it's just such a complicated thing. I don't know what I would say to a child in that moment about their parents, but I'm remembering one person that was on the show who I think is now maybe a therapist or a counselor, and sharing her experience growing up, and I think it brought me some like secondhand peace, that she had made peace with her mother, because ultimately as an adult she came to understand that this was an illness, and that it's a really hard illness to grapple with. I mean, we think people have choices, and I'm not taking away certain degrees of responsibility, of human agency, but as one of your brothers said, sometimes you're just hustling out there just to not feel sick, right? And I don't know how I would explain that to a child, especially a younger one, right? But I will say for myself, when I have a 4-year-old son who's going on 5, and of course now he grasps certain concepts and asks questions and asks me what I do for work and what do I do at the van, right? Because the organization I work for is best known for having a mobile health unit that parks outside the city jail. And so he asked me, what do you do at the van, and so on. And I say in general terms, just because he's 4 or 5 years old, that I help people that are sick, right?
Right. Mm-hmm.
And I also don't mean to, categorize and clump people, and that's the only way that I see them, right? There's so much more to people than just their addiction, and I think that's something that we have to do better at too, as a society, right?
Right.
And as family and friends and such, right? But at least for
I think that's perfect, right, for a child.
For a child, a 4 or 5-year-old, and I'd imagine, or I'd encourage any parent that is grappling with addiction to describe it as what it is. It's an illness.
Right. I think that's perfect. My daughter, is 6. She can totally understand that. And I think that now that the conversation is so much at the forefront, then we can have these conversations. And I think that's why I started this programming, so we can start hard conversations earlier. Because I very much think that when I was growing up, if my mom would have said, your dad is sick, that's why he doesn't come around, that could have helped me heal way earlier. I wouldn't think, oh, maybe he just doesn't want to be around me. So I think that's perfect advice, actually. So what would you say to the person watching? They're in their addiction and they're ready for help, and even someone is watching and they're afraid to seek help. Like, what would you offer to both?
I'd probably offer, for the person that's ready, just I'd be ready for them. If they were coming to, I know that we try really hard to be there for people that are ready. We try hard to get them seen by a doctor and a nurse, because we know that with addiction, you got to strike while the iron's hot, because if someone's ready today and you say no, there's no guarantee that they're going to come back tomorrow, or that they'll feel the same way tomorrow. And I know that's tough in practical terms to always abide by, 100%, right? I mean, sometimes we're at capacity and we can't, but I think it's really important, at least for myself, for the company that I work for, and for anyone else that's in this field, is to try as much as you can to be ready for the person that says they're ready. And to realize that you can't microwave the recovery process, right? This is something that for people is years in the making. They're going to fall off the horse. And when they do, it's important to not judge that moment as a moment of failure, as a lapse, but rather as a normal part of the process. And we do our best to just encourage them to get back on the horse.
And what about the person that it's afraid? Like, this has been my crutch, this has been my life, this is what I'm used to, but I noticed that I'm struggling. Like, what would you tell them?
Yeah, I mean, the first thing that comes to mind is like that, back to the pain, right? The pain that they're trying to deal with. And like, I would probably ask someone that is afraid, is this the only way? Right? Maybe starting off with like, what purpose is this serving you? Right? And 9 times out of 10, they might say something like, I do this because this trauma or that trauma or this pain. And then I would probably ask, is this the only way to deal with your pain? Is this the best way to deal with your pain? Right? So yeah, change is hard, but it might be worth it.
I like that. And in your program, is it any therapy? Like, do you promote like talk therapy or anything like that? Counseling?
Yeah. So the model of our program is to offer low barrier sort of access to medically assisted treatment to people that are least likely to receive it. So mostly people that are coming out of the jail. A lot of our patients are homeless. And for that reason, this hasn't gone without controversy, by the way, but for that reason, we don't sort of mandate talk therapy or meeting with a counselor or group participation, support group participation. We don't mandate it, just so that we can get people in the door and get them the help that they need. That's not to say that stuff is not important. I really do think it is. Because the medication can do some things for you. It can save your life. It can prevent you from going out one more time and this being your last time, right? But as far as dealing with that pain and that trauma, I do think it's important, but it's not something that we mandate. We have support groups that people can come to if they want to or not. One of our sites has a licensed social worker who's very experienced. She offers one-on-one therapy sessions. And then, of course, we try to link people to sort of places where they can access mental health services and support.
It's probably a one step at a time thing at this point.
Right. Yeah. I mean, some people do. Some people do get overwhelmed by the number of requirements and things, and maybe that works for some people, and for some people they can do that. Others they can't. It's hard enough as it is to go to the doctor once a week, and then also have to go see a counselor and also go to group. And like I said, I mean, there's a place for everything. There's some people that do want and or need that sort of intensive support, hence, intensive outpatient or inpatient, right? But I think what we were seeing as an organization was people falling through the gaps precisely because there was no place that just said, okay, you know what? Meet with a doctor, meet with a nurse. We'll get you started on Suboxone. You can meet with the outreach team or the case manager, if you ever have any barriers, but we just want you to come back, right?
I think that's amazing. I'm going to say that because my organization obviously promotes therapy and healing and mental health, mental health. But I think mental health and like therapists is already a stigma. Mm-hmm. Then you have, the substance abuse. That's too. It might be too much. It might be overwhelming, and you're right. That might be stopping someone from coming because they're like, I have to talk about my feelings, and so I think that's great. That is not a mandatory thing. Yeah. So, Andrew, what would be your final takeaway that you want to leave with the audience?
A change in perspective about addiction. There was something that your brother Vernon shared, and I think I referenced this a couple minutes ago, but when he shared that sometimes, people go out and they hustle and they get high just to not feel sick, right? It made me think about those moments where, we see panhandlers, and often this discussion about panhandlers is that like a common thing against it is like, oh, I don't give them money because, they're just going to use it on drugs, right? And when your brother reminded me of that, right, of how people sometimes get high so let's say that were true, right, what that person is saying, like, oh, they're just going to use drugs, right? It's like, well, even if they did, yeah, so that they can feel normal and not terribly sick. So what I'm trying to say is like just changing our perspective and understanding addiction better. I think, I'm a better person for understanding this epidemic a little better. And I encourage everybody to try to understand it a little better, because it's coming to a point where it's really hard to not know somebody that is grappling with substance use of some kind. So I think it's best to be prepared with the right knowledge and the right frame of mind, so that, God forbid, but if and when the time comes where you have to support a family member or a friend that is dealing with this, you're somewhat ready to do it in a supportive way.
I love that. I think we should all educate ourselves on anything that is pretty much a stigma, because it's our ignorance that keeps us in looking at things in certain lights. So I think that's wonderful. And I just thank you so much for talking to us and our viewers today. This was very informative, and I'm going to keep having these conversations until we break generational curses, until we start healing more. And definitely, I'm going to have this conversation so that no one else suffers the loss that we suffered, and that no one also that's going through the substance disorders feels like they have to do it alone, and feel judged, because we are here and there's a lot of people here to help you. And as always, if you like what you see here at Letters TV and Letters from My Mama, please like, please share, please comment. And you can also donate to the work that we do, because we're trying to take this on tour next season. As always, I'm Amber Sharice, and thanks for watching.
If you've enjoyed this episode of Letters from My Mama, please consider supporting us by subscribing to our channel, sharing this video with a friend, and donating to Letters TV. Thanks for watching.